Howdy YouTube family, it is Bolt CRNA and it is part 2 of our interview with Dr. Chuck Biddle. Last time we got into epidemiology, his history with the Vietnam War, how come he became a CRNA, all those great topics. Today we're talking more about the AANA journal and being the editor-in-chief for all these years, what that's been like, the struggles of that and the triumphs of it. And we're talking more about his work with Apex Anesthesia, what's coming up in the future with that big conglomerate powerhouse company. Without further ado, let's get into it. I want to know from this macro view that you have over the journal and the AANA and what's been going on for all these years, what has been some of the greatest pleasures or rewards about being in that role, and what's been some of the biggest challenges?
Yeah, when I became editor-in-chief of the AANA journal, circa, I'm thinking 1970, 1980, probably 87. We'll put that. And I started working with the journal as a junior reviewer, probably 1986. So that role transition occurred very quickly. And I can't really remember why that happened. Maybe I was the first one to put my hand up in the room, or maybe someone volunteered me. I don't know. But Jason, coming up in June, and no one would know this because, I happen to know it because I'm so intimately involved with the journal. But the June issue of the AANA journal will be its 90th birthday. Wow. Now, the AANA journal came into existence as a way to bring people who had very poor training and education in anesthesia, to provide them with almost kind of like a notebook of how to do it. That's how that journal was born. It was born as a purely kind of supplement to help people understand how to give anesthesia. That's literally how that journal began. Wow. And over the years, it has pretty much maintained a purpose of providing education to folks. In about the mid-1980s, and I'm not saying that I created this, I'm just telling you how the evolution as I see it looking back, it began to become more of a voice for people like you and nurse anesthetists who wanted to share their ideas, novel ideas, based on evidence and research to promote anesthesiology from a nurse anesthetist perspective. And that momentum has grown considerably. There was a punctuated evolution that took place probably around 1990, when programs then were moving to the mandatory master's degree format. And then there has been a secondary kick, a whole level of magnitude amplification of the quality of research and effort, largely because of the movement to the DNP and the DNAP. So the nurse anesthesiology discipline is now fueled from within rather than from without. Does that make sense?
Yeah.
That's not to discount. That's not to discount the basic scientists and the anesthesiologists who have made incredible inroads. But I can give many examples of nurse anesthetists who have made outstanding basic science contributions to the field of anesthesiology, and those are continuing in the refinement of the way that we use drugs, in ERAS protocols, and the kind of thing that you're going to see in the upcoming journal about the new drug. It's become a voice for the nurse anesthetist, but not just an opinion piece, an evidence-based, scientifically founded publication that is read by people worldwide.
Yeah. It's been one of my favorite I really don't read much magazines or newspapers and stuff, typical millennial, except for the AANA journal. That's really the only thing that I do read. And I think they're switching to digital, correct? Instead of
print? You can access. We have created a very nice digital version of the AANA journal, so you don't even need to get to read the hard copy unless you want to.
Right.
But no, we have come a long way in moving to a digital format, and it's been one of my aims and goals. And I'm lucky to work with people in the Chicago office who are like-minded in terms of moving to a more, electronic digital platform. So yeah.
So you would say that your biggest rewarding aspect of being editor-in-chief of all these years is seeing it morph and transition into what it is today, or has there been other things that have been rewarding about it?
I think in the bigger gestalt for me has been that that I feel like I have played a role in giving CRNAs a voice into mobilizing and advancing our profession. I feel like that I have been not the primary, that's not what I'm saying, but that I have played some role. And to me, that's a legacy that I am very, very proud of. And when I hand the reins over to somebody, whoever that is, that's what I'm going to say is, keep that ball rolling, because we have definitely given a voice to the AANA, to the profession through that journal.
Certainly.
I mean, that's our trademark. That's how we brand ourselves.
Yeah, I mean, I honestly, as a student who graduated 2 years ago from a DNP program, that was part of our what we were pushed to do with our DNP research was prepare it so that it could be like put into the AANA's journal.
Right. Right.
And so, I mean, that was one of our goals, is like put it out there, have it published, things like that. So it's definitely is a goal of all students who are training now. And if you think about all the CRNA students across the country, they're all just hoping to get put in the AANA journal. So you're right. There's a lot of people who are trying to contribute. And now that you have so many CRNAs who are educated to a point where they're learning more about research and performing literature reviews commonly and stuff, you are having a lot more people from the inside who are just naturally creating, new ERAS protocols for their hospital or doing opioid-free anesthetic. I interviewed Tom Barrybow recently for the channel, and he's, the Society for Opioid-Free Anesthesia is something he just like created on his own as a CRNA, and is like pushing that kind of research and that kind of change in anesthetic methods. So it's a really exciting time. I mean, I know I'm a young CRNA, so I haven't been around a long time to see previous types of ways that it was practiced, but I've listened to my elders and I've heard the stories of how things have grown and changed. And I think it's really exciting. And I think you have played a big part in the way that journal has, shifted and grown, and now is just highlighting CRNAs from within, which is awesome.
And the whole ultrasound, guided, regional anesthesia for blocks. We've tried to make an effort to, promote that as a patient safety enterprise, as a clinically sanguine way to approach patient care. And I will tell you, and I don't want to embarrass anyone. I don't want to mention names. I could do that off the air at some point in time, but I will tell you, absolutely, and I am saying this, and I would say this to someone who I admire greatly, as someone like Brian Sykes, who's at Dartmouth, who is one of the top ultrasound guided regional anesthesiologists in the world. I know of a nurse anesthetist who is published in our journal, works for our journal, and has promoted this, who is as qualified and as superb in this domain as he. And that particular individual teaches in an academic program, not in my academic program, but teaches in an academic program, has published, is mentoring students, has done national workshops. I mean, we are no longer just followers, Jason. We are leaders. And I think that, being an older CRNA who has seen a lot of ups and downs in our profession, the movement to calling ourselves, nurse anesthesiologists. It was a foreign idea to me at one time, but I can tell you, I am on that train and enjoying the ride.
Yeah.
We are not technicians. Well, we are, but we are more than just being technicians. We are contributors to the profession in countless different ways. Pharmacology, physiology, you name it, technique. And it's all about patient safety. And I think that the journal is helping, again, to give people like you a
Mhm.
voice in
Mhm.
contributing to the profession in a
Yeah.
scientifically and peer-reviewed way.
Yeah. It's amazing. I love the AANA journal. On my Instagram highlights, I'll be talking about it. And I've even done some YouTube videos where I just talk about one of the topics in the journal, where it's,
Great.
whether it be politics that it's covering, or it'll be talking about a new, pharmacology, something, anesthetic technique. There's all kinds of topics, and that's amazing. So I try and share those when I see them. But I do want to hear about what some of the struggles have been with working with the journal, not all just the positives. What's been
Oh,
some
no.
hard times?
Yeah, you bet. All the years I've been on the journal, and you can do the math. Since
Mhm.
1987, that's a political appointment. Now you can just imagine uh, surviving politics for that many years. There's no question that I have made people very unhappy over the years, have made some people happy, that I probably created, I wouldn't say enemies, but, people that were not, particularly vocal supporters of me. So I think one of the big challenges that I have had a bumpy road with some of our presidents who saw a different purpose or a different mission for the AANA journal than I did. Uh, the journal has largely remained out of the politic. It's been we've never bashed anyone. We've never said that we are necessarily better than anyone. We've
Mhm.
laid out the facts there. And I've had some confrontations with folks over the years about why we're not more verbal. I've also, you will notice if you look at our editorial board, we have 2 anesthesiologists on our editorial board, and we publish a lot of papers by physicians. And what I and I have received a lot of criticism for that. Why isn't it just nurse anesthetists? And why are you publishing? And what I would say is, remember, we are a peer-reviewed publication.
Mm.
We review manuscripts in a blinded fashion. The reviewers don't know who those people are, and initially I don't either. We publish things on the basis of merit. We have 2 anesthesiologists agreed on our editorial board, and we have something like 30 folks on our editorial board now because they happen to have particular specialties that we feel are genuinely needed for our publication to give our readers the highest quality. So, you know, it's like judging someone from the inside rather from the outside, just the kind of
Right.
thing that your mother told you to do,
Mhm.
many years ago. And it has been a struggle. The other
Mhm.
struggle I would say has been that I have for many, many years tried to make the AANA into a monthly publication. We only publish 6 times a month, excuse me,
Mm.
six
A
times a
year.
year. And that's been a struggle and has caused me some lumps and bumps over the years. We're going to remain just 6 times a year for a whole
Mm.
bunch of reasons that are not worth getting into here. It's economics, it's all
Mhm.
about money. It's all about, manpower, that sort of thing. And, we're not anesthesiology or the New England Journal of Medicine or JAMA, where we have a gigantic staff of people
Mm.
devoted just to a journal.
Right.
Most of the folks are volunteer.
Mm.
And at the national office, there's just not that many people. They're double tasking. They're not only doing the
Mhm.
journal, they're doing public relations, they're doing all kinds of other things. So, you know, those have been the real, I would say, sore spots. But
Mhm.
they have been overwhelmed by the positivity, and I tend to
Right.
be a very optimistic person.
Totally. I mean, if you've been doing it for 33 years, obviously it's not been that bad of an experience.
Not been
You've
that
stuck
bad.
with it this long. So
I think I qualify, Jason, for a Guinness Book of Records. I don't know of any other editors of any other journals that have been doing it,
that's
and I'm
quite,
not sure how to explain that. But it's been a great ride. I have no
that
regrets.
is. And during all this time, I mean, you've not only been practicing clinically, of course,
Yeah.
as a CRNA, but you're also, as of this year, you're a emeritus professor at the
Yes.
Virginia College of Common, or is it Virginia Commonwealth
Virginia
University?
Commonwealth University.
Yeah, VCU. But before that, you've been a professor full time there for how long? I mean, many years.
21 years.
21 years maintaining professor and teaching and managing classes and students and things like that. I mean, this is a lot to juggle, with a schedule. I can't imagine how busy you must be.
Yeah, well, the thing that's made it busy is, believe it or not, and I'm in my 60s, but I have two young children. I say two children. Okay, well, they're teens. No, one is 2 and one is 4. Now, I'm sure you're wondering, like, what?
Yeah,
But that is the thing that takes up most of my time, believe it
I
or
bet
not.
it
My
does.
2-year-old and my little girl, my little boy, and they're healthy and happy. And let me tell you, that's a full-time job right there. The
I
other
can't
stuff is the
imagine.
easy stuff.
Yeah, I'm sure. My father, I actually have a 2-year-old brother and I have a 13-year-old brother.
Okay,
So my father remarried when I was 21
there
and
you go.
to a younger woman who wanted children. And so he has a 13-year-old and a 2-year-old, and he's like 65, I think, this year. So,
Yeah, yeah.
yeah, it's, I see that from my own personal family standpoint that it's rewarding and he loves it, but also I'm stressful. I have no kids and I can't imagine having kids because I don't think I can handle the stress at my age. So maybe I'll do it when I'm in my 60s
Yeah.
and then I'll be ready. But
Yeah.
anyway, so I'm sure juggling all of those things for all those years, it's like a marathon you've been running. So now you're just taking it easy, juggling 2 and 4-year olds, with but also your new thing that you're working on is
Yeah.
Apex. So
Yeah.
Apex Anesthesia, which a lot of you probably already know this, but those of you who do not, Apex is like the major premier board prep program that I used it for 3 years. It's pretty much mandatory at most programs from what I understand, that like you just need it to study. And my professors actually incorporated elements of Apex into our lectures. So they would say, we would discuss a topic and we would go through the PowerPoint presentation, and they would be like, okay, so this is the pulmonary section. So when you go home, I want you to research up on Apex, the pulmonary section, and I'm going to pull random information from that module, and it's going to be on your test. Like the material from Apex about pulmonary will be on your final exam, even if I didn't mention it in class. So that's the way they would like enforce us to go home and study Apex material and other materials besides just our lecture notes, to try and diversify our knowledge. And so Apex has become integrated so much now, it's pretty much ubiquitous with being an anesthesia student. And so I want to hear what it's like from your side as a new person working with this powerhouse.
So, well, first of all, I'm surprised at the question, and I want your readers to know that Jason and I didn't had no idea what Jason was going to ask me. We had none of this is prepared,
No.
and my bosses at Apex, Dan Fresca and Kevin Baker would be mortified to think that I'm going to try to promote or advertise, and that's not what this is about. What I would say to your readers in response to your question is that I was a professor at BCU for 21 years. Before that, I was a professor at Dartmouth College in their anesthesiology program. I was the chief nurse anesthetist up there. I had a dual appointment. And before that, I was a professor at the University of Kansas. So I've had this long academic career, and it came to me in the fall of 2020 that it was time to do something different. I'd had a tremendous ride in academia. I had, working with students, working in the operating room, et cetera, et cetera. But I knew both of the owners and developers of Apex, Danny and Kevin. They were my students. Kevin was a student of mine in his foundational program, and Danny was a student when he came back to do his DNAP.
Wow.
So I knew these guys, and I watched while I was at VCU, I watched them build this intriguing platform of digital learning. I'd never seen anything like it, Jason. I was amazed at what I saw, and to see their, how should I say this, their obsession for the learning experience, their idea to literally strive to offer a world-class educational experience that, as you just said, is my understanding, and I don't have the numbers, but I do know that they are supported and used by over 100 nurse anesthesia programs in the United States. To see this, that when an opportunity came up for me to join that team, I can tell you, I jumped at it. It was a nice segue from a long time academic career into sort of being a content editor and a content creator for Apex. And these guys are, it's a CRNA owned and operated company. That was attractive to me. The idea that a CRNA, or for that matter, a student, and remember, you mentioned the student component, but there's also a huge CRNA component who are preparing, for the,
CBC.
The CPC.
Yeah.
And it's a place where a customer like yourself or a student can go to. It's kind of a one-stop shop. You can get everything that you need at Apex. And I know, because I have seen it evolve way before I got involved with it, that it is truly a world-class, cutting-edge entity that is led by two folks with, and I don't often throw this term around. This is not something that I have. I am not a visionary person. I'm the kind of person who I would say is very goal-directed, where, you give me, I take that back, that I'm more of a task-directed person. You give me a task, I will do everything I can. I'll put my heart and soul into seeing it through. But these guys are able to, they have that ability, I think, to kind of see beyond the horizon. It was very clear to me that they began to put things into motion that wouldn't play out for maybe years to come. And we're seeing those yield fruit now. So it was clear to me that this was an opportunity too good to pass up. So I have been a full-time member of the Apex team since January 1st of this year, when I resigned my position at VCU, and I transitioned to this thing called Professor Emeritus, where I stay connected to the program, but just in an unpaid way.
Nice. So what is it you're doing? I mean, I don't know how much you can discuss, but like what type of work are you doing for Apex? Research?
No, well, yes and no. What we're doing is part of my one of my many tasks is to create what are called CRNA updates, which would be something that I put together based on a synthesis of the literature and put it together in kind of a creative and attractive format for people to learn from, and at the same time, get Class A credits for. But it's not just regurgitation of information. It's trying to present stuff in an attractive, clinically relevant, and evidence-based way. So I'm doing a lot of that. I'm preparing practice exams for the CPC, and I've done 2 of those now. And that's turned out to be a big effort, where you go to the sources that you are allowed to go to, and generate questions, and then generate rationale for those questions so people understand why the answer is correct, or why others are incorrect. I'm working with that. I'm making sure that that the content that they have up is up to date. Everything has been digitized. We work with a medical illustrator who is just extraordinary. I mean, she can bring things to life in a way that I didn't even know was possible. I feel like I'm working with like Steven Spielberg, where you're able to bring to life these concepts through some sort of visual thing. And in some ways, it's like the Khan Academy, and in other ways, it's like being like in a classroom with some top-notch professor, and it's a great mix. And they're 2 great guys, and they're all about customer service. I will say that.
They're really,
and they seem to have good success.
Oh yeah, they've had great success. And I think part of why they do so well is because they are kind of visionaries. Like you said, they started to create this thing years ago, before this was such a common thing as these interactive, software that you can learn from. And like you mentioned, the program is so nice because when you answer incorrectly, it gives you a rationale of like why the correct answer is what it was, why what you said probably was a little bit off. And that helps a lot with learning for, for CRNAs who are going back and relearning, but especially for students when you're trying to understand concepts and prepare for boards. It kind of gives you an idea of why you are slightly off, because some of the answers will be very close to being correct. And it helps kind of realign you. And I will say they're very progressive in the way that they try and approach their business model and their customer service. And they've implemented new things like the podcast. Well, it's not so new anymore. I guess it's about a year and a half, 2 years out now, but they have a podcast now, the Apex Live podcast, that discusses, auditory forms of information and topics for you to kind of learn if you like to learn that way, and it's free. And they've reached out to me when I graduated and asked me to do a little video clip just for the students. I don't know whatever happened to that video clip. It may have gotten tossed. They may have said thanks, but no thanks, and tossed it, because I've never heard anything from them since then. But I did record a video clip of myself kind of giving a little bit of a review of what my experience taking boards was like. Because at the time I had a YouTube video series of a couple of videos about my experience taking boards and how traumatic it was. And I'd use Apex a lot to prepare, and I was vocal about that online. And so they said, hey, if you want to record a little clip, we'll use it. I think they said they were going to incorporate it somewhere. Like I said, it may have got tossed. They may have been like, this is no good, get rid of this. But it was so interesting to me that these guys were like, hey, we don't need students who are brand new CRNAs to do little live videos talking about their experience with boards, but we think students will relate to that. We think other people using the product may kind of connect with that kind of candid discussion. So we want to reach out to people and incorporate that into our product. And so I think that's what makes them so great, is they just reach out to a lot of different areas and just try and cover as much as they can to meet all the needs of all the clients.
Yeah.
So it's really great. And I'm really excited to see you working with them now with your long line of, your history with the AANA Journal. And Kevin told me personally that he was excited to have you on the team too. So I know that everybody is going to be looking forward to what you're doing with the CPC and the Apex and preparing people, CRNAs, for that and whatever else projects you end up working on.
Yeah.
Well, all right. Dr. Chuck Biddle, it has been a great conversation. We have talked for way longer than I expected us to, but you're such a conversationalist. I can tell that we could talk for another hour here about all kinds of stuff. But it is late your time. You're on the East Coast and I'm on the West Coast. So it is getting late for you, and I'm going to let you go. But did you have any last words of wisdom or anything that you want to say out there to the students out there watching this, or ICU nurses who want to become CRNAs, or even the CRNAs who are interested in maybe doing research or getting involved with, trying to create system changes and things like that? Do you have any special words of wisdom?
Well, I know there are words of wisdom, but I'll share a couple of observations. Number one, I have never met personally in my entire career a CRNA who got burned out.
Nice.
I have met hundreds of nurses who have gotten burned out, and anesthesiologists, not hundreds of anesthesiologists, but I've met hundreds of nurses who have gotten burned out. It is an extraordinary field. The thing that I think it demands the most of you is a buy-in to being as safe and humanistic as you can possibly be. And also, it is mandatory to be a lifelong learner.
Yeah.
And if you're looking for a place, those of you that are not nurse anesthetists, or those of you that are aspiring in programs to become, to get that CRNA, you could not make a better choice in your life, but you got to be lifelong learners, because I can tell you, I can give you hundreds, not dozens, hundreds of examples of things that are continuously evolving in this field. So that's what I would say. As someone who has been in this field for four decades, it has been a great ride, and I'm looking forward to a few more years of this ride. So,
nice.
Man, I am double thumbs up in this field.
Yes,
no lack of enthusiasm here, man.
Agree. And that is quite a review when you have someone who's done it for as many years as you have and been spread out in so many areas, and you are still endorsing, saying this is a great career. And you hear that all the time, guys, from CRNAs, that they love what they do and they would never do anything else. Rare for you to find a career that so many people say that. So awesome. Great advice. Thank you so much for coming on today, Chuck. It has been a pleasure. And we'll see you on again, hopefully another time when you're doing your next big thing and taking on the world in another way. We'll have to do another interview. Okay.
All right. Thank you.
All right, guys. It has been a pleasure having Dr. Chuck Biddle on. I really am so impressed by him. It makes me feel like I need to be doing more. I need to get out there. I need to be writing books. I need to be becoming a published author and writing for the journal and doing more. There's so much more that I could be doing. So with powerhouse mentors like this guy, it really makes us all think, you know, the sky is the limit. We can do whatever we need to do. And he's so humble too. And I don't know if you guys noticed that, but he never refers to himself as Dr. Chuck Biddle. And even though he has all of these titles and credentials and has every right to be kind of full of himself, he's not at all. And it's really impressive. Make sure and hit that like button, hit that subscribe button. If you're here this long, why are you not subscribed? We do videos every Monday, so come on back, hit the subscribe button. And if you want to get into CRNA school, you want to become a CRNA, go over to the channel memberships over here. Join up. I offer study guides, I offer resume reviews, I offer mock interviews to help you get into CRNA school. I offer coaching and mentorship, one-on-one chats, behind the scenes videos and stuff. Tons of great resources over there, guys. If you want to become a CRNA or you just want to support the channel, head over there, hit up the memberships, and I'll see you over there. Until next time, let's bolt out.